hygienist today. It's nice to meet you.
Nice to meet you. Great to have you here. I'll show you the way.
Great, thank you. Okay, let's see. My next patient is Mr. Watson. He's been coming to the practice for 5 years. All right, he's an ASA2, insulin-dependent diabetic. His perio looks pretty healthy, but these records are very old. All right, let me go get him. Hi, Mr. Watson. My name's Mary, and I'm going to be your hygienist. How are you today?
I'm all right. How you doing?
I'm good. Okay, so what I'm going to do is I'm going to start by doing your routine assessment and collect all your data, probably take some x-rays, and then we'll do your cleaning, okay?
Well, that sounds very extensive. You know, I usually don't have that much done.
Okay, well, I'm just filling in here today, so I need to do things the way I'm used to, but I'll be quick. Don't worry about it, okay?
All right, I trust you.
All right, great. All right, let's get started. All right, tooth number 21, we have a 5, a 6, and a 6. BOP, then we have 6, 6, 5, BOP again. Let's see. A little bit of mobility. Okay, let's get this charted. Okay, Mr. Watson, so I finished doing all of the assessment. I'm going to go and get Dr. Zapata now to come in and do a nice exam for you, okay?
All right, that sounds good. I'll be here.
All right, just hang tight. I'll be back in a minute.
Yeah, sure.
Dr. Zapata?
Yeah, Mary.
I just finished doing the workup on Mr. Watson, and, you know, he's got a lot going on. There's a lot of bleeding. There's some mobility, some pocketing. So I really think that you should look into that when you come in, okay?
Sure, I'll go take a look now, okay?
Okay, great.
Let's go, lead on. Alright, Mr. Watson, I'm going to do an intra and extra oral exam. And I don't see anything extra oral, so we're just going to go straight into the intra.
Okay.
Let's see. So tell me, what have you been up to? Last time I heard about your farm, you got a new breed of cow, right?
Yeah, we gotta sell some Jersey cattle up in there, and it's been working out pretty nicely.
Yeah, nice. I can tell this belly, it's the belly of work, of hard work on the farm. I myself got Holsteins. I got Holsteins. I only have one Jersey cattle. A few chickens running around. I just chase them. Alright, I'm not seeing much actually. It's looking pretty good. Little stain right here on number 31, okay, Mary? Just make sure you get that.
Yes, doctor.
And the records are pretty good. I don't see any pockets or anything. Alright, so we'll see you in 6 months. Okay, just do a deep cleaning. That's all he needs. And we're good, right? Okay.
Mary, an experienced hygienist who received training from the best professors at Middlesex County College, decided right away what she was going to do in this situation. No, that wasn't quite right. Mary had plenty of other options that wouldn't end in her license being revoked, complete humiliation, and third-degree battery. She could merely complete the deep scaling and root planing, thereby complying with the dentist, leave the office as a temporary worker, and never return. But ethically, this would violate the principles of non-maleficence and beneficence. This action would not minimize harm to the patient or create the best outcome. It would merely show that Mary was an unethical, spineless coward. She does have another option, though.
Mr. Watson, I spoke with Dr. Zapata. I don't know where he stands with this. In my opinion, your periodontal condition is not ideal. So since he's unavailable to talk to you right now, I really want to try and help you. So in here, I've prepared a referral for you to Dr. Sheree Cernecco. She is a periodontist, and I would really like for you to go see her, okay? But please keep this between you and me, all right? So it's Dr. Sheree Cernecco, okay?
Scratch.
I'll write it down for you. Nobody knows how to say her name. It's fine.
Oh,
Okay? Do you have any questions for me?
No.
Okay, so then just take this with you. Okay.
This option would violate the virtue of veracity, as Mary did not disclose to the dentist that the patient was referred. Referral is also not within her scope of practice. The virtue of societal trust is also affected because this choice may lead to the patient assuming that the dentist has not made the right decision and does not have his best interest in mind. Let's see what Mary is considering next. Mary could report the dentist's behavior to her placement agency. While this action might not have legal implications for Mary's career, she could quickly earn a reputation as a troublemaker among the dental community and risk rejection in her potential job assignments. Mary would become an outcast in the dental world. But Mary has one last option available to her. She could speak to Dr. Zapata directly and attempt to maintain all 6 virtues.
Excuse me, Dr. Zapata.
Yep.
I really want to talk to you about Mr. Watson. I know I'm only a temp in your office today, but I'm really concerned about his periodontal condition. He's got 5 to 6 millimeter pocketing, bleeding on probing, mobility. I know you're a confident doctor, but I really think he needs to see a periodontist. So if you're willing to consider it, I'd like a referral to Dr. Sheree-Soneko, the periodontist, please.
Well, now that you made me color outside the lines, I gave you deep cleaning as a treatment plan, right?
Mm-hmm.
Okay. And you found all of this after the exam?
Mm-hmm.
Okay. So, I'll give you the benefit of the doubt. We'll go with Dr. Skyer, Skorneko, Doctor.
Whoever that is, yes.
Make sure he knows how to spell it. I can't
I'll write it
spell
down.
Yeah, okay. Because I'm actually probably misspelling it. Okay, don't alarm him. So just tell him to see him after you finish just getting that stain off that I mentioned before, okay? So
Okay.
get that, we'll refer him out, and we'll be good.
Thank you, doctor.
No problem. Hey, Mary. Good job.
Yes. This was the option above all other options. Mary could maintain societal trust as the dentist had agreed to refer the patient. She could also maintain beneficence because she kept the best interests of the patient in mind. She also let the patient make an informed decision on the matter, following the virtues of autonomy and veracity. Mary had made up her mind. She wanted this option, the best option, and that is exactly what she did.